Madeline Leininger was born in July of 1925 in a farming community in Sutton, Nebraska. She started as an elementary school teacher, actually, but then she quickly switched over to getting her nursing degree at St. Anthony's Hospital School of Nursing in Denver, Colorado. She then moved to get multiple undergraduate degrees. She got her Bachelor's of Science in Biological Science from the Benedictine College in Atkinson, Kansas. And then she also got an undergraduate degree from Creighton University in Omaha, Nebraska, and that one focused on teaching, curriculum, testing, and measurement. So then she moved on to not only work as a nurse, but she also got multiple graduate degrees, and the first one was a Master's of Science in Psychiatric Nursing. So that was from the Catholic University of America in Washington, D.C., around 1954, and then she moved on to achieve a PhD in Cultural and Social Anthropology at the University of Washington in Seattle. She also was faculty at the University of Cincinnati in Ohio, where she did a lot of research and focused on combining care and cultural awareness into nursing. She also was the director of the Nurse Scientist program at the University of Colorado School of Nursing, where she mentored lots of students, and then she also was the dean at both the University of Washington and the University of Utah. So her academic record is pretty impressive, and she's been all over the place, and she's also presented her theory and research all over the world, as well as received honorary doctorates for that research. So she's written more than 30 books and articles on her research in transcultural nursing and caring, and she eventually died in August of 2012 in Omaha, Nebraska.
Madeline Leininger is a nurse, and she founded the transcultural care theory, which is also called the cultural care theory, and it's pretty self-explanatory in that it is all about the way that culture is relevant in nursing care. So in the 1970s, Madeline really was kind of the pioneer of the influence of culture in nursing care and how that affects what nurses do. And so she basically was highlighting the ways that different cultures receive care and feel cared for in different ways, and it doesn't always translate cross-culturally. And one of her main points was that nurses need to be educated to notice culture and to know different cultures and to be aware of that so that they can provide the best care for their patient. And so the burden of responsibility really does fall on the nurse in this scenario and not on the patient to explain their culture, but the nurse to have some cultural background and to be aware of that through education, because education is the main way that this is going to happen. And that was her platform as a dean of a nursing school and in implementing culture classes in nursing school. So this is a model called the Sunrise Enabler that really explains Leininger's transcultural nursing. It's kind of a way for nurses to assess the cultural situation of their patient. And so it's depicted as a sunrise, and the very top of the sunrise would be the expansion of your worldview. And so there are three kind of different ways to look at this, and that would be cultural care, preservation, and maintenance. Down at the bottom, the three things are shown, and then cultural care, accommodation, and negotiation, and then cultural care, repatterning, and restructuring. So most of the time, the nursing care decisions and actions are going to have to reflect one of these three things, and most of the time it's going to be trying to preserve and maintain the cultural background of the patient. And in some cases, there may need to be some type of negotiation and accommodation, so that's when you look at that second option. And then last case scenario, cultural care would be repatterning and restructuring some of the cultural beliefs of the patient in order for them to receive adequate care. So there are three kind of different bubbles that you will look at, and that's generic or folk care, traditional nursing care, and the professional systems. And so all of these three things need to kind of be balanced in the care of the patient in order for them to be fully cared for. So there's a few different main influences that are in the yellow boxes on different aspects of culture that can affect nursing care. And so those would be technological factors, religious and philosophical factors, kinship and social factors, cultural values and beliefs and life ways, political and legal factors, economic factors, and educational factors. So all of those things are influences that are going to relate to healthcare and the nursing process. So all of these individuals are seen in the health context of their cultural care, of nursing care, in the professional systems. So in order for these cultural aspects to be fully developed for the patient, they're going to have to be balanced between the cultural care and the nursing care in order to have that balance and that the care being the best care that it can be. And so when all those things are related with each other and with their influences, with care expressions, patterns and practices, and with the holistic health, illness, death that's seen in a cultural development, all of those things are going to lead to expanding of a nursing worldview. And that's going to, when all of the cultural and social structure dimensions are put together, your worldview will be expanded. So in summary, this model is a way that nurses can assess they can ask questions about these certain factors of culture. So they can ask questions about religious and philosophical factors, for example, or for kinship, social factors, things like that. They can ask questions about how this would typically be the care expression, patterns and practices for these typical things within that culture. And they can balance that with the generic folk care, with nursing care, and with the professional systems and how they would handle certain aspects of care. Then they have to decide how to act, and in order to either maintain and preserve the culture, accommodate, negotiate, or repattern and restructure in the very last case scenario, and that leads to culturally congruent care for health and well-being, or for dying in that instance. And so this is really just a model to help nurses assess all these situations, grow in their worldview, and really just make sure that they are providing the best and most culturally congruent care for each patient that they encounter.
The transcultural nursing theory is used in research to help nurses with communication among different cultures and how to best interact with these patients. This shows how to interact with each culture during certain drastic events or certain situations that can happen within the hospital. It helps to explore the differences within cultures and how nurses can respectively interact with each. This is important for research as it can lead to developing meaningful relationships, which is very important for nurses to have with their patients. Within a country that is very diverse, we can see many different ways people can interact with pain, loss, and healing, all that come from their culture. For example, there was a list of nursing actions created in order to give culturally competent care to patients. This can be in a scenario such as having a patient with a Hispanic background or culture. Within this Hispanic culture, it is rare to see an older Hispanic male go to the doctor regularly. So if you are a nurse and you know this information and this background of this culture, you'll be able to go in with that patient and ask more questions, and also know that whatever this Hispanic male is feeling or telling you about his pain, that it is probably way less than what it actually is. And so it is very important to pay attention to all the labs, the scans, and the tests, and go through these nursing actions that are created for culturally competent patients in order to best provide care for your patient.
As mentioned before, Madeline Leininger is the founder of the transcultural theory. The purpose of the theory involves knowing and understanding different cultures with respect to nursing practices, beliefs, and values, with also the goal to provide meaningful nursing care services to individuals. The transcultural theory is used in nursing education, research, and clinical practice. I'm going to focus on explaining how this theory is used daily in education and clinical practice. In an educational aspect, Madeline Leininger's transcultural theory serves the opportunity to provide ways healthcare professionals can implement holistic care. This is important because it is our job to care for patients in the best way possible. The theory attempts to provide culturally congruent nursing care through assistive, supportive, and facilitative decisions that are tailored towards individuals' groups, culture values, beliefs, or lifeways. The intent of the care is to fit with or have beneficial meaning in health outcomes. We have seen many examples of the transcultural theory used in education. There is purpose of learning and being aware of different religions such as Buddhism, Christianity, Islam, Hinduism, and much more. This is so healthcare professionals can serve people well. Many nursing schools and hospital policies require individuals to learn this information so that we can provide holistic care. Asking and completing a thorough assessment once a patient is admitted can impact the way the patient is cared for while staying in the hospital and even impact the nurse's way to provide care. The theory elaborates on a thorough assessment that nurses can implement. This provides holistic and a comprehensive overview of the client's background. The assessment addresses communication, language, gender considerations, sexual orientations, abilities, disabilities, occupation, socioeconomic status, and interpersonal relationships. The reason we ask these questions upon assessment conveys how nurses can treat patients with the best practice of care. The transformation of nursing through the educational process has been directed towards using a comparative global philosophy and the practice of nursing in which nurses are living and functioning in diverse transcultural communities. Nurses need to remain sensitive and knowledgeable about many cultures with different ways to practice and provide nursing education. Because of Madeline Leininger's transcultural theory, there has been an influential shift in how nurses care for their patients for the better. Now that we have discussed ways Madeline Leininger's transcultural theory in an educational aspect, let's discuss how her theory is used in clinical practice. Early in her career as a nurse, Leininger recognized the importance of the concept of caring in nursing. Frequent statements of appreciation from patients prompted Leininger to focus on care as being a central component of nursing. During the 1950s, while working in a child guidance home, Leininger experienced what she describes as a cultural shock, when she realized that recurrent behavior patterns in children appeared to have a cultural bias. Leininger identified a lack of cultural and care knowledge as the missing link to nursing understanding of the many variations acquired in patient care. These insights were the beginnings of a new construction of the transcultural nursing theory that we have today. Nurses who understand and value the practice of culturally competent care are able to affect positive changes in healthcare practices for clients. Sharing a cultural identity requires knowledge of the transcultural theory concepts and principles, along with the awareness of current research findings. Culturally competent nursing care can only occur when clients' beliefs and values are thoroughly and skillfully incorporated into nursing care plans. Caring is the core of nursing. Culturally competent nursing guides the nurses to provide holistic and culturally based care. These practices also help the client to care for himself and others with a familiar, supportive, and meaningful cultural context. Continual improvement and expansion of modern technologies and other nursing and general science knowledge are integrated into practice as if they were appropriate. Many nurses are faced daily with cultural diversity because of the increasing numbers of immigrants and refugees. Commitment to learning and practicing culturally competent care refers to great satisfaction and many other awards to those who can provide holistic, supportive care to all patients. An example of how this theory is used in clinical practice is assessing nutritional needs, spirituality, orientation, ethnicity, health beliefs, and socioeconomic level upon admission. I believe education and clinical practice go hand in hand when it comes to Madeline Leininger's theory. What one learns in the classroom is what should be applied in real life. Having a strong foundation and acknowledgement of assessing and asking questions such as, how can we make your stay at the hospital more spiritually comfortable? Or are there any nutritional needs that you would like us to know about are vital whenever we're caring for a patient. Because of Madeline Leininger, we are able to provide the best holistic care for anyone that walks through the hospital. Thank you.